everyone. Good evening. Welcome back to our Grand Boulevard Coalition show. As you all may remember, if you watched me a couple weeks ago, I am going to be the main host of Grand Boulevard Coalition. And in these shows, I kind of want to talk about different types of topics related to social issues, substance use prevention, education topics, and just any topics that are relevant to youth and adults in our community areas that we work with. I work for a program known as Chicago Area Project, and Grand Boulevard Coalition is a part of that. So before we get into what we're talking about today, I want to show a couple flyers to you all. The first flyer is going to be from my program, which is Healthy Living, our number one goal. And September 21st of this month, we will be having a National Opioid Awareness Day Zoom webinar. So that is from 3 p.m. to 4. And we have the Zoom information right there. So if you want to, take note of that Zoom meeting ID at the bottom, that will kind of save you for that webinar that we are hosting. And so basically what that's going to be about is we're going to talk about different kinds of opioids, addiction. And if you remember what I talked about in the last show, we talked a little bit about fentanyl, which is an opioid. We're going to talk about prevention use and how to prevent an overdose and things like that. So we're going to have a little PowerPoint presentation that day that's going to be hosted by our staff and our team, me included. So if you want to see more of my face, we'll be there on Zoom on the 21st. And the second flyer I'd like to show is for Grand Boulevard Coalition's 10-year celebration. So this is also on the 21st, but this one is a little earlier, from 12 p.m. to 1:30, and this one is in person. So it's an in-person event at Mount Carmel Baptist Church. The address is shown below, and you can RSVP using that code right there. So you can just scan that with your phone. And that is basically going to be a 10-year celebration. 10 years since GBC has been awarded a grant that has helped them work with target communities in the 60613 area, I believe, and as well as another zip code area, 60653. So we are kind of excited that this is going to be like a little 10-year celebration to celebrate all the accomplishments and successes of this initiative and program. So if you are in the area, know where that address is, are kind of nearby, have the time, feel free to stop by, RSVP. There will be food and refreshments, as well as some speakers. One person that I know that will be there to do a little speech, a couple people actually. One is my supervisor, Laurel Dudley. She is one of the directors and works with Grand Boulevard Coalition to help spread the message and share resources, that we have kind of been working to get the youth access to, essentially. And she's going to be doing a little speech about the history of Grand Boulevard Coalition, as well as a fellow colleague of mine, William Penn. He is also going to be there and doing a speech as well as some other people from Chicago Area Project. But yeah, so that's some stuff to be on the lookout for. If you have the time, remember that our Healthy Living program Zoom webinar is going to be at 3, and that will be from 3 to 4, if I didn't mention that already. But yeah, so we're excited to have you all join if you can. And those are some exciting things that we have coming up this month. So I wanted to get a little bit into Grand Boulevard Coalition and just talk a little bit about the initiative, and kind of some stuff that I had mentioned before is this initiative has been something that has gone on since 2013. They've had a grant that has kind of aided them in reaching communities, mainly youth, targeting youth in working with them to kind of teach them about substance use, such as alcohol and marijuana. That was their main focus, was those two substances, because they had noticed a rise of use in those substances in those target zip codes that I had mentioned earlier. So what they would do is go to high schools, go to other programs, and just connect, with other organizations and work with youth to teach them about the harms, potential risks that can happen as they get older if they continue to use with alcohol and marijuana, as those things can be harmful to undeveloped young minds. So yeah, it's been really nice working with them too. Our program, Healthy Living, has been able to work closely with Grand Boulevard Coalition and has helped get us into some high schools too. Since we both kind of have similar aligning goals and values in our programs, we've been able to connect with some schools such as National Teachers Academy, I might have mentioned before. We were able to talk to about 74 eighth graders, which was really great. Talking to them about marijuana and fentanyl and just the dangers and risks of underage use. And as that school had mentioned that they had a heightened amount of reported use of eighth graders and high schoolers using marijuana in that school. So kind of targeting those kinds of communities, at-risk youth that may not know about the harms and things like that about marijuana and alcohol. And it was really great to see that they had genuinely learned a lot from our presentation that we gave them. We did a little Q&A afterwards to make sure they were actually paying attention, and they really did find a lot of the things interesting that we talked about with them, which is so good to see. I believe after this 10-year celebration, this coalition is going to take a break. I'm not too sure about that, or if there's something in the works, not too sure, but if I have any updates on that, maybe next time I'll bring it up if I remember. But yeah, so that's been something that's been really exciting. I wanted to give a special shout out to William, as I mentioned earlier. He's been working with Grand Boulevard Coalition for the past 7 years as a program coordinator, and then the last 3 years as the president of Grand Boulevard Coalition. And you have definitely seen him on this show. He used to run the CAN TV show for the past who knows how long, but he's been here, he's been around, very active in the community and basically everywhere. So a special shout out to William Penn if he's listening. He was supposed to come join me today, but he is busy planning for the GBC event on the 21st. So I don't blame him. I know he's very busy. But yeah, so special shout out to him. And that's kind of a lot of, I don't know, just exciting stuff that I wanted to bring up and share because it's a really great coalition that's been going on. But yeah, so kind of moving on to another topic. This week, or I guess on the 10th of September, we'll start the National Suicide Prevention Week, and that is going on from September 10th to the 16th. So that's kind of that week where people are going to really focus on mental health, suicide prevention, reaching out, doing groups, just like spreading information on social media that you'll probably see around if you use the hashtag Suicide Prevention Week. They're going to share a lot of great resources. And I just wanted to share a couple of things related to suicide prevention and kind of, what can lead to suicide, what are some risk factors, some protective factors. And because it can be seen in youth, and youth have definitely experienced a lot of heightened issues, I guess, in their communities, such as COVID and just, any type of community violence too, bullying, things like that can really affect a person's mental health and a young, kid's mental health, teenager, even, 10-year-olds, and they have experienced very traumatic experiences. There's been some things on the news a while back about, I think it was like a first grade teacher that got shot by one of her students. So like being in a classroom where that has happened is something that's really traumatic and can severely impact the mental health of a child. First graders are like 8 years old, so 7 or 8. So being that young and seeing something, witnessing something like that, maybe your favorite teacher or just a teacher that you like and you see at school every day getting harmed by another fellow classmate of yours is something that is very troubling. As well as you all know, school shootings have been a serious matter here in the United States, and it's affected young kids too, and high schoolers, and even some colleges, right? So it's something to be aware of, not just traumatic experiences, but other things that can go on in a kid's life. And that can be, from a range of things. So it doesn't have to be anything as traumatic as a school shooting, but there have been other factors. Like I said, bullying is something too that happens that's very serious. But just kind of getting into that kind of thing. So I guess a little trigger warning for those who may not feel comfortable talking about these things or thinking about these things. I'm going to be going a little into depth with that right now. So yeah, just important things to be aware of if you're a mom, a dad, a parent, just looking out for your kid and you maybe see that there's something up. This can be maybe like a wake-up call or a sign to check in on your child or check in on a loved one, anyone that you may feel has been going through something recently. But yeah, so we're gonna kind of talk a little bit about what leads to suicide, right? So there's not just one single thing that can cause someone to become suicidal. Like it can be so many things. It's a range of things that can happen. So suicide most often occurs when stressors and health issues converge to create an experience of hopelessness and despair. So many conditions like depression, anxiety, and other mental health issues, bipolar disorder, schizophrenia, those kinds of things, they can range and people can have a multitude of diagnoses on them as well, right? So maybe someone has ADHD and depression, or somebody has bipolar disorder and anxiety and depression. So that can be a range of things, and this can kind of heighten somebody to be more likely to consider suicide, for lack of a better way to phrase it. But it's more heightened in certain populations, people who live in certain areas, people of certain economic status. So it's quite of a range of different environmental factors, and things like that. So another thing too is substance use, right? So that's something that we focus on. And we kind of see that people who use substances are also more likely to have issues like anxiety, depression, suffer from mental health, right? Trauma. People will often go into substance use because of trauma or because of lack of just getting help, right? So they will, instead of, maybe they don't have access to therapy, or maybe they can't afford it, and other means that kind of help relieve that anxiety and stress temporarily are substances. They can give that sense of euphoria, sense of just forgetting your problems and things like that. And that could kind of escalate into creating a worse mental state over time. This is something that is also, that we see in teens and adults especially too, right? Because adults are the ones that are more, it's legal to drink as a over 21-year-old, so you have that access to alcohol as an adult, an easier access, I'll say, because teens can still find ways to access alcohol in their homes, fake IDs, getting an adult to buy beer for them, things like that. So I won't say that teens don't have that access, but it is definitely easier for adults to get that access to substances, cigarettes, vapes, all those kinds of things. That you have to be older or of a certain age to be able to access. So that is another way that it can, affect a person and their mental state, which can kind of lead to higher risk of suicide. And other things, let's see here. It's important to note that most people who actively manage their mental health conditions go on to engage in life, right? So it's not to say that, because you have anxiety, because you have depression, you're automatically going to be a person that considers suicide, and go through with it or something, or have suicidal thoughts, things like that. Like, we're not saying that, but we're saying that these people are higher risk. And like I said, there are those resources that are available to help people who have anxiety and can have access to therapists that can teach them different ways to be able to better manage their anxiety or depression. And just having that access to someone to talk to is very important too. But yeah, so kind of going into some risk factors, which I kind of went a little bit into already, mental health for sure. But let's talk about what is a risk factor, right? So for those of you who may not know what the term risk factor means, risk factors are looking at a person, looking at different aspects in their life and seeing, okay, what about this person makes them more likely to become depressed or makes them more likely to be suicidal or have suicidal tendencies, suicidal thoughts, which stems from things like, severe chronic depression and things like that. So what kind of are those factors in that person's life that don't make their situation any better, but instead make their situation and mental state even worse? So going into like mental health in their environment, like I said, environmental factors for sure. And if they've experienced trauma or abuse, there's something known as ACEs, and that is basically looking at a person's childhood and seeing how many traumatic experiences they have had throughout their childhood, seeing how severe they are, and that kind of affects a person's how can it affect a person's mental state when they get older, as well as other factors such as their overall health, not even just their mental health. But they're, going to the hospital or going to the doctor and are more likely to have heart issues, other types of issues with their organs, and more likely to get other types of diseases and things like that, just because of what they have gone through in their childhood and things that they have experienced and the amount of times they've experienced trauma or other types of things. So, like child abuse is an example. That is something, if it has been like ongoing child abuse, that is something that can affect someone's mind for a long period of time, very long. It's a long-term effect that it has on someone's, brain and their mental state. They kind of grow up maybe being more afraid of the world, not trusting people. So therefore they start to isolate themselves, right? And they kind of grow up not really talking to anyone, so they might be going through something mentally and not going to talk to someone and getting the help that they need, not opening up and feeling comfortable opening up because of that child abuse that they experienced when they were younger. So that is one example of that. And like I said, environments. Let's say someone lives in an area that is more likely to have violence in their neighborhood. There are more robberies, more shootings, more fights going on. And so maybe it's like a teen that's trying to get to school, and there's people fighting on the street. They see a shooting on the street that they're not necessarily a part of. But if they see it or if they just hear, the gunshots, that's also a traumatic experience. Your fight or flight kicks in, your heart starts kind of pumping really fast. You get scared, you run, try to find a place to hide to protect yourself. So these are things that can kind of create anxiety in a person, right? If they live in a community where they're constantly on edge and trying to make sure that they're safe, they don't feel safe in their home because they feel like maybe someone's gonna come in, break in, things like that. So just those are some examples of what can of how environmental factors kick in if you live in an unsafe area that can heighten your anxiety, mental issues, and things like that. So yeah, what are some protective factors now? So protective factors are basically the opposite of risk factors. So what are some things in this person's life that can essentially protect them from the dangers of falling into certain negative trends, negative lifestyles like drinking, isolating themselves, things like that, right? So what are some protective factors? Some examples of protective factors are having like that open environment, in your family, friends. So let's say you have people in your life that you can talk to openly about your mental health, and you're not shy to talk to them about it. And they're not shy to kind of ask you about it or talk to you about it as well. And they're open about their own mental health, right? Because you don't feel comfortable sharing things about personal things about your mental health if you're struggling, if you feel like the other person won't understand or isn't going through that kind of thing. So it's important to find people that you trust, that you relate to. If you're a part of a certain community, like the LGBTQ community is someone that is a community that has a heightened chance of suicidal, thoughts, tendencies, and actually following through in those with suicide. So because people, they grew up in this, in an area where, such as like let's say a southern state, for example, where they, it's like a high, I don't want to get too political on here, but let's say you live in an area where you just don't feel welcome in the as an LGBTQ person who falls into that community. You live in an area where you see a lot of people who are very anti-LGBTQ, and you feel unsafe in your area. You feel like you can't open up to anyone, not even your family, because I wish I had some statistics, but a lot of kids who come out to their family and parents have been sent to the streets, and a lot of them become homeless. So there is a high population of LGBTQ individuals who live on the streets, and that's due to being what's the word? Basically not accepted by their family or by people that they felt like they could trust. So a lot of people stay hidden, they hide their true selves. And yeah, it just creates a very stressful situation for them. They kind of keep to themselves, isolate, and kind of that's how those tendencies start. But finding communities of people, maybe online too, where you feel like you can relate to some people. They have online forums, groups on different social medias where you can find people to relate to. So some other protective factors, having access to resources, right? If you have health insurance, there's easy ways to get connected to a therapist or to a treatment center where you feel like you might get the best help available for you. So those are some things, some protective factors that can help. So just being in a good environment, having high schools with good resources such as social workers, counselors who constantly check in on maybe higher risk students who may be of low income families or minority groups and things like that, because we need definitely more resources like that in a lot of our schools. But yeah, so while I have the time, I'd like to share a little story of one of my friends that I had known about 5-6 years ago. Her name was Sarah, and she was someone that was very important to me. She was a friend that I met at Northeastern in my time in college there. She worked at the rec center where I worked, and she was someone that I had started to get to know. I didn't know too well, but I really enjoyed her personality and wanted to get to know her more. She had opened up to me about certain issues that she was facing as a person who was a part of the LGBTQ community, and had even admitted to having acted on some suicidal tendencies. And it was something that was very scary, and I didn't know how to react, right? As someone who had never met anyone who had been struggling like that, and I had offered my support and told her that I was there for her. Unfortunately, she had passed away later that year, and it was due to suicide. So we ended up at my school having a little vigil and talking about our favorite memories of her and just trying to keep her memory alive. So that's something that is very, very sad. But I wanted to share that because I want to keep her memory alive, and I still always try to in my daily life. So I just wanted to give that little remembrance to her, and just know that if you feel like there are people that don't care about you, there are so many people that care about you if you open up to someone that you trust. Please let them know how you're feeling. But yeah, so just, be aware, talk to someone if you feel like you need support. There are people available in Chicago, so many resources. Thank you so much for listening to my show. I hope you all have a good rest of your day, and we'll see you next time. Thank you.